Thank you so much, and thank you for attending my session. I truly appreciate that. So let's get going. We can move on to the next slide, please. Thank you. So there are positive and negative aspects of personal smartphone use in the healthcare setting. Patients interact with their nurses every day, several times a day. It is possible that when a nurse uses their smartphone for personal reasons, distractions from patient care may be impacted. This does not mean that every time a nurse looks at their smartphone, they are distracted. And we will learn more about the findings from this study. So what is the problem? For the non-healthcare industries, studies have concluded that participating or scrolling Instagram, Facebook, or watching TikTok videos or internet surfing while at work creates a distraction. This study focuses on personal smartphone use by nurses with direct patient care responsibilities. In non-healthcare industries, distractions can possibly lead to distracted care. I should say in healthcare industries, they can lead to distracted care. So what is the purpose of this study? The purpose of this qualitative study was to describe the perception of nurses regarding distracted patient care in their clinical workplace due to personal smartphone use. The gap in the literature did not address the actual perceptions of nurses regarding distracted patient care due to their personal smartphone use. What is the significance of the study? Based on the gap in the literature, the study may extend the knowledge based on the empirical evidence specific to the nurse's perception and the explanation related to the distraction conflict theory's premise that the use of the smartphone conflicts with their primary patient-facing task. Ultimately, the distraction becomes the primary focus. The perceptions and insight of the nurses provided a professional application that may contribute to the formation of strategies, education, and policies that affect the positive social change that heightens the awareness of distracted healthcare. Now let's go to the theory. Barron's 1986 distraction conflict theory, which was extended by Min in 2017, provided a theoretical lens for exploring the influence that distractions and interruptions have on work performance. The distraction conflict theory can be defined by three conceptual components. One, other individuals are a distraction. Two, the distraction can develop into the employee's attentional conflict. And three, attentional conflict increases focus on the secondary task. The increase in focus on the secondary task progresses to impaired performance and motor behavior on complex tasks. The next slide, please. We know firsthand that work-related distractions happen a lot, and studies and regulatory agencies correlate interruptions and medical errors. In the nursing practice, nurses are expected to have positive patient interactions, which include the ability to listen, understand, and respond in a positive manner. In some cases, the nurse-patient interaction may be compromised if the nurse is distracted by their personal smartphone. Patients may perceive that the nurse is focused on their smartphone instead of providing care. Our practical experience shows that interruptions may help the nurse to gather relevant information that ultimately provide the appropriate care for patients. If there is a misalignment, the impact on perceived patient care, professional nursing accountability, and responsibility for healthcare institutions are at stake. Policies and procedures to develop accountability and the responsibility of nurses include guidelines on the practical use and application of personal smartphones in the workplace. A number of nurse participants reiterated the concern regarding TikTok videos staged on the patient floor and the possible risk to patient privacy, the institution, and the nurses' reputations as competent caregivers. The next slide, please. The research question was, What are the perceptions of nurses regarding distracted patient care in their clinical workplace due to personal smartphone use by nurses? This qualitative single case study research provided the appropriate framework to ensure that the researcher is the instrument to collect data. I used the professional website LinkedIn to recruit nurse participants for this study. I sent over 1,000 emails to nurses who met the criteria. Ultimately, I was able to interview 22 nurses, which included 18 semi-structured interviews and 4 focus group participants. An additional 32 nurses completed the online open-ended questionnaire. The majority of the participants, about 50%, were employed in a hospital setting, and the next largest percentage, at 17%, were tied and worked in outpatient clinics or were traveling nurses who were assigned to hospitals. The data analysis process revealed several relevant participant life experiences or concerns. A total of 42 codes, 9 subthemes, and 4 themes were revealed. Some of the codes are: provide a safe environment for patients and themselves, recharging and disconnecting for mental rest, looking up medications, the use of the phone as a personal computer, and the ability to have immediate access to family in emergency situations. Some subthemes included patient education, COVID-19 concerns, social media use during work hours, identified negative distractions, and identified positive distractions. The themes included personal attachment to their cell phone, patient privacy risks based on cell phone use, and nurses not perceived as professional. The next slide, please. Both negative and positive distractions were discussed during the interviews. Unanimously, the nurses' participation in social media activities during work time was identified as a negative distraction for both the patient and their peers. The consequence of the nurse's smartphone use while at the bedside may also negatively impact patient openness and engagement. Moreover, excessive use of the smartphone at the bedside may inhibit the opportunity for face-to-face interaction and impair social skills and development that enables positive rapport and sensitivity, especially during the pandemic when nurses were wearing face masks and eye protection at the bedside. The patient could not see a smile. The findings of the study may contribute to positive social change by guiding nursing management to define policies and practices that may minimize distracted patient care based on nurses' smartphone use. The only acceptance of social media activities that were the exception occurred during the nurses' break, and the smartphone and the ability to scroll their social media was perceived as a way to stay awake during their downtime or when patient activity was minimal. Participants indicated that their smartphone was a vital tool to stay connected with family, children, and friends. This study also extends the knowledge-based empirical evidence specific to the nurse's perception and their explanation related to the distraction conflict theory's premise that the use of the smartphone conflicts with their primary patient-facing tasks. The next slide, please. This study was conducted during the pandemic, and nurses expanded the level of communication to ensure their family's safety, which was also verbalized by the night shift nurses who missed their family while caring for the patients and donning protective equipment, which continues to prevail. To review the interpretation, this study confirms that most of the staff nurses held a positive viewpoint regarding personal smartphones at work because the device was considered useful technology. The nurses indicated multiple reasons for the benefit of their personal smartphones during their work hours. Most of the nurses were responsible for multiple patients simultaneously, and they used their smartphone to perform their tasks in an efficient and quicker manner. Now, looking at the limitations of the study, the results may not represent other healthcare providers, for example, physicians, patient care partners, and may be specific to nursing. Second, the personal smartphone use of the nurses may vary and may not be representative of the different nursing populations. For example, nursing assistants, licensed practical nurses that were not included in the participant criteria. The recommendations from the study are, in addition to work-related activities, managers should allow nurses to use their smartphone to get through difficult personal times, support or check in to see if everything is being taken care of at home, take a mental break during their shift, and retrieve information for patient families. The well-being of the nurse is an important factor in their ability to deliver empathetic care to patients. For the social change implications, they include the perceptions and insight of the nurses, which will provide a professional application that may contribute to the formation of strategies, education, and policies that affect positive social change that heighten the awareness of distracted healthcare. The results and recommendations that emerged from this research will prove helpful to leaders and managers and human resources departments in healthcare organizations. Finally, the findings identified the need for leaders to remain open to the needs of the nurse and their smartphone use while balancing and providing guidance to avoid negative implications, for example, a distraction from patient care. Creating fair and equitable personal smartphone use policies that incorporate the practical application of the enforcement is an important factor that will contribute to positive social change regarding nurses' personal smartphone use at work. There is much more detail, over 300 pages, in this dissertation that will give you examples, give you the voice of the people, a voice of the nurses that I spoke with. Their quotes are heartfelt. This is something that's near and dear to them. Personal smartphones are not going away, and nurses need them just as much as anyone else who is not in the healthcare profession, but nurses are using them now to help them to enhance their roles, or nurses have also perceived it to distract them from patient care, which may impact the delivery of that care. One example of a nurse gave me an example of another nurse, a peer, that was so distracted she did not hear the bells that were being alerting them that the patient was in a crisis. And ultimately, that patient passed away. And to the day that I spoke to that nurse who witnessed this, she still felt the negative impact of that and will always correlate it to the distracted patient care due to that smartphone use. So this is a study that is going to have far-reaching ability for nurses and others if it's expanded. So I thank you for taking the time out of your day to attend. I hope that the results resonated with you, and if not, provided other perceptions for you to consider. This study includes additional information and findings and is available in ScholarWorks or ProQuest. So thank you for your time and attention. If you have any questions, I'm here to answer.
Thank you, Doctor. I have a question for you. And Charlie, if you have a question as well, feel free to use the chat or unmute your line. But what prompted you to use this as your study? Did you have an experience or something that led you to want to study this topic?
That's a wonderful question. I am in my profession is human resources. And one of the cases that I was working on, I was also responsible for employee relations, happened and became a case. One of the nurses decided to call in to the NICU, that's where the babies are born that have concerns and issues, and called in. And when she called in, the nurse who picked up her smartphone to answer it said, "Oh, how are you?" and began to take the phone and walk it around the NICU saying hello to the nurses that were there. Luckily, there were no families there at that time. And,
Mhm.
at that point, anyone who is off shift is not, is not privy to what's happening in the hospital.
Mhm.
So as a result of that interaction, and it was brought to our attention by a nurse who was holding one of the infants and was very upset that this was happening, and was grateful that a parent wasn't there to witness this. And ultimately, of course, it's a violation. First of all, you
Mhm.
should be using your smartphone for non-work related things. And second of all, you had HIPAA issues as well. So I
Mhm.
thought to myself, if this is happening today, where else is it happening? And
Right.
is this something that needs, because people didn't have sense when they were calling in while they were off shift and while they were
Mhm.
walking around. So common sense left the building. So if this is
Yeah.
happening here, it must be happening elsewhere. And sure enough, that became the topic of my dissertation. It was like being the light bulb went on. And as I went on to study, of course, it's happening elsewhere. And of course, the nurses have some stories to tell about smartphone use in the workplace, because it's a good thing or it's a negative thing. It depends on how you
Mhm.
use it. So it literally gave me 300 pages worth of information to share in my dissertation. So yes, it was a light bulb moment of an actual case that prompted this. So thank you.
Yeah. I wonder. Yeah. Yeah. It's a really great topic. And I can see how it would just span across all kinds of different disciplines and work environments. And so very interesting. And I do see that Charlie has asked a question in the chat as well.
Yeah, I can talk about it. Thank you very much for your presentation. Very interesting. I especially because I teach a DBA program. So I heard, if I'm right, and you interviewed 23 people.
Yeah, about, yeah.
Yeah, that's a large number, isn't it?
It's a large, for a qualitative study, that's a lot of interviews. That's a lot of
Yeah, I'm
time.
very impressed. You also conduct focus groups. I
Yes,
think also take effort for that.
yes.
And my question is, how do you perform qualitative data analysis in terms of so many data, have
Mhm.
interviews, folks, notes, all kind of thing? How do you do this?
Yeah, it's a lot of data, right? So, and it's a lot of data, especially because you have to document it, send it back to the participant to make sure that you heard them right.
Mhm.
I did record them. So I did phone interviews, Zoom interviews, and I recorded all of them because this way I can do it verbatim. And I also used an app. It's called Otter,
Okay.
OTTER, and you dump it in there, and of course it garbles whatever it is it doesn't understand. So you have to read through it and make sure that the wording is correct. But at least it helps you in the beginning process, so you're not sitting there for 20 some odd interviews verbatim trying to get them done. So that was like a trick that I actually had to look up on the internet, because I thought all these interviews is a lot. That could take you weeks and weeks and weeks to do. And when you're at the crunch at the end of your dissertation, you don't want to spend an extra moment not getting to the finish line. So that immeasurably helped. But ultimately, the data analysis I used in vivo. So they have, in vivo sells a student version of it. So you don't have to buy the whole, whatever. If you're a researcher by trade, yes. But if you're just using it for your study, then it gives you a license for a year. And then you can literally dump everything into that software, and it shakes things out so that you define how you want it done. So in this study, I had my themes, my sub-themes, and my codes. And ultimately, the codes were what was said most frequently. So the words that came out happening over and over again. And then you put those into themes that make sense to you, and you can literally push those over to themes. So you don't want to work in Excel. It takes an awful lot of time because then you have to go through it piece by piece. And then the subthemes. So ultimately you're narrowing it down to really what are they trying to say. And the in vivo helped an awful lot, but as you're speaking to your participants, you are hearing sometimes the same thing over and over. And that's why I stopped at a certain number, because I could have stopped 2 people before that because they were starting to repeat the same information. But I just wanted to ensure in case there was anything else that someone else had to offer. But you will see that the repetitive nature of the qualitative work, especially if you're hyper-focused on the participants. So the question that you have there, I only focused on nurses because if I included physicians or any other group, it will dilute what the nurses are. And because the study has to be so specific, you want to be able to say, how does a nurse perceive this? And I even narrowed nurses to RNs and APRNs. So I excluded LPNs, I excluded nurses assistants. I excluded those groups specifically so that I can hyper focus just on nurses, what anyone would consider an RN type nurse who is at the bedside, dispensing the medication, doing all of these different things so they kind of level set themselves. So that's, to me, I mean, if I had someone tell me before I was doing this, now that I've done it, any study needs to be hyper focused, and then anything that can be used to expand as part of your dissertation or your proposal or whatever it is you're writing will be something that somebody else can jump on. That expands the knowledge base that you are setting, because every time you do something like this, you are expanding the knowledge base on what someone else did before you. Now someone else can expand the knowledge base and say, what are the perceptions of physicians who use their smartphone as smartphones at work, right? That can be their proposal or their study, however which way they want to do it, and so on and so on. So I hope that helps.
Great. Thank you very much for information.
Oh, you're welcome.
Thank you for the question. Okay, well, that concludes the session today, unless there are any final words that you wanted to share, Dr. Crisculo.
No, I am so grateful to be able to share this study. It's a lot of years of work, and it meant so much to me because it was a real life experience based, from your question, it was a real life experience and it's not going to stop. So I'm so looking forward to seeing how the knowledge can be expanded based on this study, and hopefully I contribute just a little bit to that. So thank you.
Thank you.
Thank you very much.
Thank you.
All right, well, you guys have a wonderful rest of your day.
Thank you. You too.
Yeah.
Bye.